Good morning. My name is Dr. Davar, and I'm a specialist in oncology at the Hillman Cancer Center at the University of Pittsburgh in Pittsburgh. I specialize in melanoma and other cutaneous malignancies, including Merkel cell cancer and cutaneous squamous cell cancer. I also attempt to develop new drugs for the treatment of advanced cancer with a research focus that is particularly focused on innate immunity, advancing the human microbiome as a therapeutic in cancer, and next generation immune checkpoint inhibition. I first met Amy on December the 7th, 2018. I got a call from Dr. Judy a couple of days prior, who informed me that he had a young patient who presented with multiple subcutaneous masses. He biopsied one of these, and it was immediately apparent that she had advanced melanoma. Unfortunately, in the time since then, her cancer had actually developed and spread quite widely. When I saw her on December the 7th, 2018, she had liver, lung, and skeletal involvement. We rapidly enrolled her in a clinical trial testing a novel immune therapy combination. However, despite that, another immune therapy combination and chemotherapy, she passed away as a result of her disease on August the 15th, 2019. Amy's death came as a huge shock to the entire team of physicians taking care of her. Her research team at the University of Pittsburgh, Dr. Judy, who referred her to us, the researchers at MD Anderson with whom we collaborated with to try and find a clinical trial option for her, Dr. Maria, and also Dr. John Punugapati, who was treating her at Thomas Memorial Hospital. As we reflect on Amy's death, we think about three important principles that could potentially help others. One, early detection and prevention. Melanoma is a disease that is increasing in prevalence in the United States, partly driven as a result of increasing exposure to ultraviolet light as a result of lifestyle exposures. It is vitally important that patients, particularly at high risk of this condition, be seen regularly by dermatologists. There are lots of excellent dermatologists in Charleston, West Virginia. Dr. David Judy, Dr. Todd Kreitzer, and South Charleston Dermatology, where Dr. Michelle Endicott and others practice. These dedicated dermatologists work with a dedicated team of surgeons who are all very well trained and, when appropriate, send patients to us at the University of Pittsburgh for further consultation. It is vital that patients see dermatologists regularly, at least once a year, and sometimes more often. These include patients of all races, but particularly Caucasian patients who are at high risk of developing skin cancer. And those patients are fair, have blue eyes, or have a history of melanoma. Recall, Amy did not have a history of melanoma. Amy actually had a history of multiple atypical lesions. However, she developed advanced melanoma. The second important principle is clinical trial access. The National Cancer Institute feels that clinical trials and access to clinical trials are critical for patients with cancer. What is fascinating about Amy's case is that we were very aggressive about enrolling her in clinical trials, and her untimely passing, despite that, does not mean that clinical trials do not work. It just means that at this time, we did not have the right drug for her. Clinical trials represent the best means to get the next generation of therapies for patients. Your care is better when you're on a clinical trial. Clinical trials are available at every stage of a patient's cancer journey. Before the removal of early-stage melanoma or thereafter, before the removal of melanoma involving a lymph node or an in-transit lesion, where the development of neoadjuvant, that is preoperative immune therapy and targeted therapy, further improves outcomes compared to post-operative immune therapy or surgery. And subsequently, in the advanced cancer setting, where clinical trials have improved upon the effects of next-generation immune checkpoint inhibitors for the treatment of advanced melanoma. And the third principle is research and access to research dollars. The National Cancer Institute supports our research efforts. However, funding from the National Cancer Institute is declining. Despite our best efforts, our access to do promising research and our ability to translate promising research findings into new therapies for patients is stymied by this fiscal roadblock. You have the ability to change this. Institutions and organizations such as the Melanoma Research Alliance, the Melanoma Research Foundation, and the Harry Lloyd Foundation, along with many others, including the Doris Duke Foundation, channel their philanthropic funding into research dollars to advance the next generation of therapies, as well as mentor and train the next generation of cancer investigators. I am fortunate to have been the recipient of several of these foundation awards, and I urge you to think at this time of supporting one of these organizations. Your support directly translates into improved outcomes for cancer researchers and their abilities to get funded. Amy's untimely passing on August the 15th, 2019 left behind a void. That void will never be filled. That void was a result of her untimely passing at the age of 39, younger than I am today. I think about this and her every day. I unfortunately have too many patients like her who have passed away of their aggressive disease too soon despite our best efforts. Hopefully, with your support, we can turn the tide. Thank you.